Hi, everyone. Welcome to our education consult series on alternative rounding styles. We've got Lily Ackermann, Margaret Chapman, Dan McFarlane, Jen Readlynn, myself, and Lin Zheng here with us to talk through some of these issues that I'm sure we've all experienced. These are our learning objectives for the session. We hope you get something out of them. So who's on the line for our consult?
I am Jen, Dan McFarlane from Ohio State. I'm really having some struggles with rounds. We've really worked hard to try different kinds of rounding styles. We've rounded sort of at the bedside, and I feel like that's just become really long, and the residents have a lot of struggles with it, and making sure that we're getting through all the patients in a timely fashion. But we've also tried rounding at the table and card flipping and just looking at the patients on paper. And I feel like we're just losing so much. And so I'm just really struggling trying to find a good way of sort of rounding in a better, more efficient way, but that still gets the learners what they need.
Great, Dan. And I think you brought up some really awesome points about things you've tried and sort of understanding our goals of rounds and what's important for our learners to get away from them, as well as continuing on with the care of different patients. So I'm hoping our panel has some thoughts. The Journal of Hospital Medicine has published some thoughts on this as well. I found this article with some strategies from UCSF really helpful to sort of think about what my team is already doing and what are some strategies that we could do. And so some of the things they highlighted in this were everybody coming to rounds, ready with their information and just focusing on the assessment and plan, sort of having this understanding that everybody knew what was going on so they don't have to repeat things. Figuring out, and this is what my senior residents do, who we're going to round on, knowing that we can't make it to everybody in our time allotted, but really having a strategy. I also like when my interns help each other and put in orders for each other as we're rounding. And making sure we all have shared goals for rounding so we know if we're gonna end at a certain time and what keeps us on track. Using different timers can be helpful for learners who struggle with long presentations. And then again, focusing on really the active problems and maybe not running through every chronic problem on rounds can really be helpful for increasing that efficiency. Margaret, do you have any strategies that you like to use?
We've been using this discovery rounds or work rounds a lot at our institution. It's got a lot of proponents of it, some detractors, but I'd love to talk through it a little bit more and see what you all think. The point of discovery rounds or work rounds are really to cut out some of those redundant activities that we find ourselves doing early in the morning and bring ourselves to the bedside to do those in the moment assessments. So gone are the days of everyone has to pre-round on every single patient, but more a thoughtful approach of who's sick, who's active, who might be discharging, who's new, and doing some directed pre-rounding to those folks, and then the whole team coming together at the bedside for discovery rounds. We see a lot of traction about this on social media, and we see some of these comments here. It's a way to buy back some time, and it really brings all of us to the bedside to talk with the patient. As the attending, it's a really nice way for me to actually get to see what my residents are doing as they're talking to patients, as they're doing an assessment, physical exam, a lot of great opportunities to do that in the moment teaching, watch their clinical reasoning. Some interns get a little stressed out when a new issue comes up or a new question comes up and you have to think on the fly, but I think it's a great opportunity to watch that clinical reasoning in real time and compare and contrast with how the resident or myself might be assessing that problem. Some of the downsides, some folks find it really stressful to not know what's coming their way. And I think this is where the resident has a great role to prioritize how we're going to do rounds. And the interns can really show their skill in checking on those specific patients to begin with. Great way for the patients to watch us working in front of them. So often we work in our workroom or in the hallway, but they're watching the conversation and the communication among us all. A great way to bring us all there to the bedside. A cool method, and I encourage trying it out.
Thanks, Margaret. Anyone else have experience with discovery rounds or work rounds?
I think one of the key things with discovery rounds is to make sure that if there are sick patients, that or urgent issues, it's okay with discovery rounds to take care of those first thing in the morning. That should always be prioritized, and that can take off a lot of stressors during the middle of rounds.
Thanks, Lily. That's an important thing to highlight for discovery rounds.
Have you guys had any difficulty with the discovery round process in terms of allowing some of the learners to present to the families? Has that caused some confusion for the families when they're presenting some of the things that we're trying to sort of, or having a discussion about things that maybe aren't completely relevant to that patient, but are really good learning points on that topic?
I think that's a great point, Dan. And it all gets in how we introduce the rounding style to the patients. It's really most effective when an intern or the senior resident starts us off by talking to the patient, say, we're going to review the information you've given us. We're going to talk about your updated test results. We might do a little shop talk or a couple of teaching points here and there, but we'll make sure at the end that we've together reviewed what the plan is for today and what we specifically think is going on for you in the course of your care. And we invite any questions that you have. But this is a great way for you to see how we work together. That usually works pretty well, but we all know that some patients love to be involved in the conversation. And so for those, it sometimes can get a little derailed. And as the attending, I might have to step in and say, we can talk about some teaching points later. Let's focus on the plan for today as a way to maintain our efficiency.
That was really valuable information. Thanks all. Does anyone have another strategy? Lynn?
Yes. So, when I asked my intern to present the case in front of the patient and the family, one thing I want to make sure they use the layman language. Because if you use too many medical terms, it can make the patient and the family more confused. And so if we have to use some medical term, it is probably a better idea to explain to the patient and family, what does this, word or term really means, and what's the plan, for this particular issue.
Yeah, you not doing the translation of we're going to talk about you in front of you and then having to translate it back to the patient. I agree. It's more valuable to talk in a language the patient and family can understand. I've also read about the structured interprofessional bedside rounds. Does anyone have experience with that?
Yes, at our institution, we do physician nurse co-rounding. It is a great experience, and we have a lot of positive feedback. So every morning when the team arrives, the patient rooms, we always ask our senior resident to find the nurse for that particular patient. Then we walk into the patient room at the same time. We discuss the care plan for that particular day. Make sure everyone understands the plan for that day. This is really decrease a phone call later on from nurse. Make sure everyone on the same page. And also, if the patient was not there at that particular time, the nurse could help to explain the care plan to the family later on. So this really improved communication and care coordination.
I think it also helps with patient safety, especially at the time of discharge. Often on rounds, we can go over the discharge plan, the discharge medications. Nursing is usually there to remind us of things that we forget on the discharge instructions, like diet, wound care instructions. And if the family's there, they can ask questions in real time about the discharge plan and follow-up.
Thanks for that insight, Lily. That's a really great specific time to use these types of rounds too.
So
And
one
then-
of the,
Go ahead,
I
Dan.
just had a quick question on that. Just in terms of what if people are just busy and not available? Like, how have you overcome that when nurses or social workers say that they can't come? Is there a way to sort of involve them later?
Yeah, that's a great question. What we normally do is once we finish a round, if the nursing staff, we're not able to join the bedside round, we always ask our senior resident to call that particular nurse to update the care plan for that day to make sure everyone stay on the same page.
That makes sense. Thanks, Lynn. Anyone else have other rounding strategies or things that they've struggled with that they wanted to talk about?
I think there's always that tension between autonomy of the residents and efficiency and supervision. I know as a hospitalist, I love talking to patients and having to take that step back to let the residents have the opportunity to talk to patients, share the plan, answer their questions is always something that I have to be mindful of when I walk into the room. With all these approaches, there are ways to achieve efficiency in the morning because we know that rounds are inherently inefficient. And so I would advise being really mindful about the amount of time each team member is talking and who really is going to be that point person for communication for the family. That is relevant in all of these rounding styles.
Yeah, thanks for that, Margaret. It seems like having a plan of who's talking, how long you expect to be in there can really be helpful to keep your rounds efficient. Okay. Well, thanks everyone. Dan, I hope that was helpful to you. I know I got a lot of tips out of it as well.
Yes, it's so great. I think that I've got a lot of things that I can try this week when I'm on service, and hopefully we all will feel better about rounds. Thank you for your time.
Thanks everyone. Have a great day.